I want to chat refinements, and I want to pick both of your brains about refinements because I've had discussions with doctors throughout the country, and opinions seem to be a little bit split. Some of our doctors use VPro to really make the treatment predictable and basically eliminate refinements on majority of their cases. On the other hand, we have some doctors who love VPro for the speed and predictability with the intention of just kind of getting through those initial set of aligners quickly and then moving on to refinement with fewer aligners for some of those final touches. Can each of you weigh in on this topic and where VPro fits into the equation for you?
Well, I'm more of the mindset that I think of, and I'm not a golfer, but I use the analogy with my patients that there's a fairway shot, a chip, and a putt. And I'm shooting for, a hole in one, but if I par, it's still very successful, right? And something like a V Pro or MOPS will allow me to get an eagle. And it's a nice analogy because they kind of get the idea that there's, something that'll help direct it towards the end game a little more efficiently. But I rarely promise, well, I never promise a one and done. I find that very unrealistic. I'm typically very close to in the ballpark after one series, but maybe I'm just a little picky and anal retentive. I'm usually not satisfied with the results after the end of one. So I like I said, I typically use the analogy that it could be up to three. And when I get done in two, or when I do get a hole in one, the patients are thrilled.